Now let's understand the ECG. For that, we will use 6 steps for that. First one, identify and examine the P waves. Second one, measuring the PR interval. Third one, measure the QRS complex. Fourth one, identify the rhythm. Fifth one, determine the heart rate. Sixth one, interpret the strip. So let's go one by one. Identifying and examining the P wave. We all know that P wave is present and seen in the beginning of the ECG rhythm. In an abnormal case, it may be absent or with no P wave. That means, as an example, we can say it's an accelerated junctional rhythm. And the second case, it will be an abnormal shape. Example, atrial flutter. The P wave will look like sawtoothed P. Next, measuring the PR interval. It represents the time taken in between the atrial and ventricular depolarization. The normal time is 0.1 to 0.20 seconds or 3 to 5 small boxes in the ECG. Next is measuring the QRS complex. It represents ventricular depolarization. Normally it requires 0.08 to 0.12 seconds, which is 1 to 2.5 small boxes in the ECG. Any changes like shortening or narrow QRS complex indicates a cardiac arrhythmia. Next is identifying the rhythm. For that, we have to measure the RR intervals. For this, we can use 2 methods. The first method, we have to count the small boxes in between the RR intervals. For that, we have to take 2 to 3 RR intervals and count the small boxes. If it is remain same, it is a regular rhythm. And the second method is using a scale and white paper. Keeping this white paper above the ECG and mark the R's. After that, we have to measure the length in centimeters or whichever measurements available. If it shows the same length or the size, it is regular. If the measurement remains different in each rhythms or the intervals, it means it's an irregular rhythm. Next is determining the heart rate. For that, we have to understand whether the rhythm is regular or irregular. If it is regular, we have to count the boxes in between the RR interval. Take the counts in one RR interval and divide it by 300. For example, we have an ECG. Let's see, we have 1, 2, 3, 4, 5 boxes. So 300 divided by 5, that is 60. See, it's around 58 beats per minute. So this is one of the method we can use during the regular rhythm to find out a heart rate. And for irregular rhythms, we cannot use this RR interval. So for that, we have to count the QRS complex. For this one, we have to make sure that we are using a standardized ECG, which is especially 10-second strips or 50 large boxes. Count the number of QRS complexes on the rhythm strip, then multiply into 6. So in this wave, we have 11 QRS complex into 6, that is 66 beats per minute. Finally, interpret the ECG. After going through the steps, we will come to a conclusion regarding the ECG rhythm, whether it is normal or abnormal. Once again, thank you so much for watching this video. I hope this video will give you a little knowledge